manipulations are?
Manipulation of the vertebrae and ribs, like bony structures.
Yeah. So manipulations are something that DOs can do. So MDs can learn it, but typically don't. Like you have to take a specialized class for it. But it's something we start learning in DO school first semester, and it's something we continue. Not all the DOs continue to do it. Most actually do not. If you see anyone who does do it, it's usually a family medicine doctor. So I describe it as a mix between chiropractic and physical therapy. So it's not like the cracking and popping that chiropractic is, but it's more than what physical therapy does. Because sometimes physical therapy will do manipulations, but it's different. And you can't really fully describe it until you actually have manipulations. Because I've done it on every patient, and I'm like, so can you describe it? And they all tell me no. So I'm going to show you guys a few techniques today of something that you can learn. So I'm going to teach you how to scan someone's back, because that's super important. That's not something that you guys get when you're in med school. I'm going to show you how to treat a first rib, and then I'm going to show you some hip and some back stuff. So if someone stand up, I need a volunteer. Stuff is good. Okay. Okay, so when I first look at a patient, I look at how they're standing. Are her feet, are her feet even? Her feet are even. Does it look like, you're not a very good model because you look fine. Her shoulders are completely, stand up straight. Her shoulders are completely fine, so you're looking, does one shoulder look higher than the other? So I never assess neck standing up. I always assess back and down. So when you start, you find the spinous process, and you go a little bit lateral to it. So like here and here is where your transverse process is. This is what you're feeling. So I use 2 thumbs. A lot of the times they teach you to scan like this. I don't like doing that. It's just personal preference. So I find the spinous process, go over it, and I scan down. Now what I'm looking for is I'm looking for a difference in tissue texture going down. And you really don't have any. So I'm gonna need a different volunteer. But then so her back actually feels okay. But then I'm always gonna check hips. So you wanna find the iliac crest, this hard bone up here, follow it around to the back where her PSIS is, and then you're just gonna let your thumbs rest there, and then she's gonna bend forward and touch her toes. And we're looking to see, does she have any, and she's good, come on, go ahead and stand up. So what I'm looking for is to see if one thumb is raising versus the other, and she doesn't have any of that. You sit back down. You have I need somebody who actually has something.
Maybe me.
Maybe you. All right, let's feel your back. All right, so we're gonna start up here. So again, we're looking. Shoulder heights look good. Looking at feet. So it's minimal, but can you guys see how this foot is turned out? Don't move. Is turned out a little bit compared to his left.
Mm-hmm.
So I suspect that he's gonna have something going on with his hips. So spinous process. Walk over. Yes, you have something. So I'm gonna have them feel your back in a minute. Okay. Got like a whole band. All right, you're a perfect model. Okay, so again, we're gonna find that iliac crest, come to the back, and then I want you to go ahead and bend forward like you're gonna touch your toes. So do you see that difference?
That's it.
That's a huge difference. This is his problem side. So we're gonna be fixing the hip on this side and some back things. So I want them to feel your back.
Yeah.
Okay?
Yeah.
All right. So start by finding the spinous process. Yep. You don't have to push that hard.
Oh, he likes it.
Probably not. But you're just scanning. you're just scanning his back.
Right here.
Yeah, so that's one of the areas you can feel how it's harder
Yeah.
on this side.
Mm-hmm.
That is what I want you to feel, is that tissue texture
And there
change.
is another one, right?
Yep. So like this is the kind of area that I'd be focusing on.
You right?
He's
Landon.
fine.
I like it.
Okay.
Good.
Okay, bend forward for me. Hold on.
So-
Hold on.
Find his iliac crest,
Okay.
and then follow it around to where the PSIS is.
Yep, right here.
Yep. Don't push so hard. Just light with your thumbs. It's gonna bend forward.
Okay. Yep.
Yeah. Okay. Good. All right. Who else wants to feel?
Okay, so I find the spinous process.
Find the spinous process. And then you go just a little bit lateral, and then you're just gonna walk your thumbs down and see if you feel anything different. And if you guys don't feel anything, that's fine. This takes a lot of practice.
I did feel the muscle tightness.
I
as
feel
well.
a muscle tightness.
That's kind of
for
what you're
sure.
feeling. Mm-hmm.
Okay.
And it's usually a specific segment, and that segment is what we're treating.
Okay, and then I find the iliac crest.
Yep.
Okay, can you bend forward?
Press a little bit later.
Oh, lighter.
Yeah, so you're just literally leaving your thumbs there. You're not pushing in. Yeah. So you're not, yeah. Okay.
Thank you.
Miriam.
You're about to get 3 brownies.
Starting
the day after all.
3 brownies and
I
your
do have a spina
espresso.
bifida cota. That would be interesting to see.
Oh, you're apparently perfect.
I know,
It
surprisingly.
feels
isn't
hard
it?
being
Find,
spinous process is in the center. This is your spinous process. This right here.
See, he's so
See?
gentle with it.
There you go. Just a little bit lateral. Like there's like a gutter almost is what you call it. It's like a dip. That's where you're going to.
yeah, right here.
Yeah.
This side's fine. It's just like tight,
Yeah.
but it still feels like bone, like bony structures.
Mhm.
And I want to put them out so I can compare.
And then
Find his iliac crest. Don't just go to PSIS until you guys are comfortable with knowing where the PSIS is. Always find the iliac crest first.
yeah, crest.
Push. So you need to push it in. Now follow the iliac crest around to the back. Where that bony process is right about there. Yep.
What?
You're just gonna let your thumbs rest. Don't push hard. Pretty sure you were pushing too hard, but it's okay.
See what's wrong with you.
Okay, so find your spinous process, go. And then go a little bit lateral.
Push this hard.
No, I feel it right here.
Wow,
Here.
it's a big difference. This is something you guys probably have not done the entire 6 weeks you've been on rotation, is my guess.
Wow.
Well, I did
Probably
do that
not.
actually when the patient was lower back pain.
Okay.
Okay.
Because I wanted to see if he was even. But I was a massage therapist, so.
Oh. So
The
then
room
you
is
you
spine
have a little
5.
bit of a,
That's why I knew he didn't. Huh.
oh yeah, PSIS. So put
It's
your
right
thumbs.
here?
So his iliac crest is here, it's right here. Okay, now put your thumbs there and just let them just kind of just sit,
Okay.
and then go ahead and So, your thumb did go up.
Okay.
You just moved it, but your thumb went up.
Okay.
Alright,
Interesting.
and then I'm gonna have someone lay down and show how I check movement in neck.
Ooh.
You didn't have anything wrong with your back.
No,
you can-
just
you can-
my neck.
Alright.
Like it hurts.
I was talking to some DOs about like headaches
Yeah.
and frequent headaches, and they said that could be something wrong with my neck.
Oh, substantially, yes.
Yeah, the tension headaches.
So there's 3 different types of migraines. So there is tension headaches.
Uh-huh.
Here's them actually, yeah. So there's
Alright.
tension headaches, there's actual migraines,
Uh-huh.
and then don't worry about the other one. So
Okay.
tension headaches, like if you have a really tight neck and you have restriction in motion in your neck, it definitely can cause migraines. I see that all the time. And manipulations is something I'll do for some patients because it's that, or like they really should be stretching and doing yoga and stuff like that.
Yeah.
Miriam, come lay on the table for me. Over here.